Hello, everyone. Thank you, Gov, for having me. So, we have exciting announcements today. As Governor pointed out, we have one new case, just one new case. And this is something to note because it's been just only a single digit or a low number for the better part of 2 weeks. It has enabled us to have the governor take some strong positions on behalf of our people economically. So we're starting with this brief look about how many cases we have. You should be reminded that our healthcare system has to be adequate before we bring tourism back or bring our economy back because people could get sick. And that's what we're always mindful of. We have 2,773 hospital beds, but only 1,404 are occupied. That's 51%. This means that we can resume some of the normalcy in our healthcare system and that we have capacity if we were to have a surge in COVID-19 to take care of people. The national standard is that you always reserve at least 20% reserve in your hospital system in case you have a surge when there's an infectious disease outbreak. Intensive care unit beds are where people who are sickest get care. 112 out of 244 are occupied. That's 46%. Very important because as people start getting surgeries that have been delayed for elective purposes, or if people are just sick in general, we'll have the capacity to take care of those individuals, and also if we had a surge of ICU need from COVID-19. Ventilators, the largest indicator you've seen me talk about before. This is if someone has respiratory distress. If that occurs because of what's called ARDS, acute respiratory distress syndrome, from any virus, but particularly this one, we would have to put a person on a ventilator. At 14%, we are very, very low, and that's good. That's good news. That means if anything were to happen, any quick change, which the governor would be more than nimble to take care of, we still have a lot of capacity to keep people alive. Total number of individuals who have been hospitalized, 73 over the course of this outbreak. Again, we are in a very good situation because of the order to close our border and prevent lots and lots of travelers here to our state. I know people have often noted the number of travelers that still come in, and though it makes for headlines, and I understand that, please do remember that we used to get 30,000 people per day. In June of 2019, we had 950,000 individuals travel to the state of Hawaii, and now we have a very tiny fraction. We, of course, don't like it when people flaunt our rules, and that's why we have our law enforcement go bust them. Now, another very important number I want to share today is the recovery rate. People have asked, how can we begin to open businesses? Well, 89.1% of our individuals who have tested positive for COVID-19 have recovered. This leaves just about 70 or 80 people total who haven't been cleared after they've had their virus. That means we have a very low viral load in the state. Oh, here we go. Actually, the exact number, forgive me, 68. 68 active cases still. And many of these people have long since left the hospital and been doing well, but we're still mindful that they could be infectious. All of these numbers are meant to underscore the fact that we've done very well. Hawaii, when compared to other states, compares very favorably because of the decisions that the governor has made. Let's talk about how we do compare. 43.6 total cases per 100,000 of our residents. That's how you add up to our 625 or 626 total cases. This is the second lowest case rate in the United States. And we're second only, I believe, to Montana. That's right. And Montana has a very, very sparsely populated state. So as for states that have over 1 million people, we have the lowest rate, and we have a major city here in Honolulu. So I think that's something to note. And probably most importantly is the number of fatalities. At 17, that means 1.2 deaths per 100,000 have occurred. That's the lowest mortality rate in the United States. And that's a very good testament to the hard work that our first responders do, nurses, doctors, our hospital system, the Healthcare Association, really everybody. So this all is meant to preface the reason that the governor was able to announce that we're going to begin to open the Kama'aina economy. And just another couple quick statistics. When we look at our economy, and the governor, when we were chatting just before we came out, noted that about a third of the people have been unemployed and needing benefits. We've talked to our economists, and as much as 60% of the Kama'aina economy, meaning jobs that can come back before tourism returns, our internal economy, our domestic economy can resume when those jobs come back. And that's very important. Someone asked me the other day, what's the best way to get unemployment taken care of as far as checks? And I said, well, people going back to work, because I know people want to work. They really want to get back out there. The last thing I wanted to mention today is where we are on the mainland, because it's going to impact us eventually. Now, just yesterday, there was a 20% increase in the number of cases on the mainland. They went from 20,000 to 25,000 cases. So 20% increase in the daily numbers. And that is because they've relaxed very aggressively some of their restrictions in states where they still have a large number of cases. So compare a state that has thousands of cases and it's surging and they relaxed their restrictions versus the state of Hawaii, which had one case and very good policies on our parks, very good coordination with our mayors. We sometimes differ, but 99% of the time we're on the same page going forward. That puts us in an extremely good place to make sure that we not only succeeded in phase one of the COVID crisis, which was making sure people didn't die and we didn't get overwhelmed, but now in the new phase as we begin to open the economy. So that is the overview. I think you should all be very proud of what you've done, and I'm excited to see how we recover as a people. So thanks for being patient.